All right. Hello, medical terminology students. Here we are in chapter 6. This week we have both chapter 6 and chapter 7 together. Chapter 6 talks about the urinary system. Chapter 7 talks about the male reproductive system. And then next week you'll get into chapter 8, which talks about the female reproductive system. I'll let you know that many times this for the urinary system and the reproductive systems, there's some overlap because of the way the systems can sometimes work together. So the other thing I wanted to share is that going forward, or now that we're into the concept of the course going forward, the medical terms and the different root words, word parts, prefixes, suffixes, root words, combining forms, they're not going to be identified by their color in the slides. And that's because I want you to be able to pick them out without the color. They are still referred to in the color in your book throughout the rest of the text, but the remaining presentations, I want you to be able to identify those. So let's get started in chapter 1, the urinary system. Urinary system, here we've got a picture of what the urinary system looks like, the organs that are in the urinary system. We've got our kidneys, our urinary bladder, the ureters, which are these tubes here, and then the urethra, which is down here. Some words, some definitions that you might see within the urinary system. We have nitrogenous, renal, urinary, nephrectomy, nephrologist, and urologist. The kidney, take a look at the picture of a kidney. Your picture is on page 148 in your textbook. Even though it's small, it's very complex. There's a lot of things that go on just inside the kidney. Its function, poof, there's a lot of functions that go on in the kidney. So here are the functions. It filters blood to eliminate waste. It regulates the blood volume and maintains homeostasis. Secretes renin, and there is a function of renin. It secretes erythropoietin. There's another function for erythropoietin, and it synthesizes vitamin D. Another component in the kidney is the nephron. So if you go back and take a look at the kidney, there's going to be nephrons in these areas right here, and there's a lot of them. But when we go here, this is a bigger picture of this small unit, but a lot of stuff goes on right here in this very small unit, and there's multiple nephrons in the kidney that are working all the time. All right, so let's take a look at some other terms that you might see in this system and referring to that singular versus plural that we talked about. So a calyx to calyces, cortex to cortices, glomerulus to glomeruli, and hilum to hilum. Right, urinary bladder and the urethra. So here we have the urinary bladder. You can see the urinary bladder that goes down to the urethra. The one on the left is going to be the male. The one on the right is going to be the female. You can see that the urethra, which goes from the bladder all the way to the meatus, which is the exit of the body, in the male is quite a bit longer than the female. The female's is actually pretty short, which actually is one of the contributing factors that females get urinary tract infections more often than males do. So the urinary bladder, let's see here. The function of it really is to hold urine, and then the urethra allows it to exit out. Here's some other terms that you're going to see in the system: meatus, sphincter, micturition, urination, and void. All right, now we get into the disorders of the urinary system. First one we have renal cell carcinoma, hematuria, acute or chronic glomerulonephritis. That one's a hard one. Glomerulonephritis. And nephrotic syndrome and interstitial nephritis. Pyelonephritis, primary hypertension, and polycystic kidney disease. Some other conditions that you might find in the urinary system: anuria, azotemia, hematuria, oliguria, proteinuria, and uremia. Disorders of the ureter, which these could also be disorders of the kidney as well: nephrolithiasis. Nephrolithiasis. In addition to the other conditions that we talked about, one of the issues that you could have in the urinary bladder or even up in the ureters and the kidney is a urinary tract infection. It can be anywhere in the system. And then in the bladder and the urethra, there's some incontinence, and there's several different types of incontinence that you can have. And incontinence would mean the inability to hold your urine. But there's the different types have to do with the cause of the incontinence. So if you look on page, let me find it in here. It starts on page 150. It actually starts on page 155 at the very end. It talks about urinary incontinence, but when you turn the page over, it'll talk about the different causes of incontinence. So you have stress incontinence. That's where you cough or sneeze or, jump on a trampoline. And that's that stress or the pressure from the bladder that forces the urine out and you can't hold it in. Urge incontinence means that you just have to go. You got to go right now. Overflow incontinence, where it just comes out. There's nothing, it's just coming out. And then functional incontinence is that you have another underlying condition that prevents you from getting to the toilet. And that could be as simple as that you're on crutches because you broke your foot and you have to be non-weight bearing for a while, and that prevents you from getting to the toilet. A stroke prevents you from getting to the toilet. So again, there's another underlying condition. Couple of other terms here. We've got urethritis and cystitis. And then quickly going on to the pharmacology and procedures. Typically anytime that you have any condition that goes with the urinary system, one of the things that they do is they do a urinalysis, which most of the time you're going to urinate in a cup. The cup be sent off to the lab, and they're looking for different components within your urine, and they can do it by this little strip right here. They put the strip in the urine, and there's different oh my gosh, different areas on the strip that are looking for different items. These are all the different things that we're going to be looking for when they take a look at your urine. It can tell if you have blood in the urine, if you have protein in the urine, if there's bacteria in the urine. Very non-invasive way to just kind of see if there's something going on. These are some other diagnostic procedures that you might see in the system, and I'll let you guys look them up. I'm sure you're reading them in your smart book, so I'm not going to review them here. But an intravenous pyelogram, retrograde pyelogram, voiding cystourethrogram, computed tomography, magnetic resonance imaging, an ultrasound, renal angiogram, and then a cystoscopy. The best way to find out the definition, honestly, is to break the terms up and determine their individual meanings, and then figure out the entire definition of the term. Some more practice. Let's take a look at some more practice. I'll read the term, pull it up, and then you guys can practice with it. So, glycosuria, ketosis, ketoacidosis, polyuria, excretion, spasmodic, hydronephrosis, permeable, nocturia, and peritubular. Therapeutic procedures, there's different things for therapy. So before we talked about diagnostic procedures, give a diagnosis. These are things that they can do for treatment. So extracorporeal shockwave lithotripsy is one of them, ureteroscopy, percutaneous nephrolithotomy, those are some of them, along with hemodialysis, peritoneal dialysis, and then the cystoscopy. More word analysis, we've already talked about some of these, but lithotripsy, nephroscopy, nephrolithotomy, ureteroscopy, cystopexy, pyelogram, and cystourethrogram. Practice, pharmacology. These are some areas that pharmacology can help within the urinary system. Diuretics, analgesics, antiretrovirals, dysfunctional hypokalemia. Again, abbreviations that you might see. This is going to be on that table in the very end of your book. ARF, CKD, CRF, ESRD, TERP. That is the end of chapter 6, and I will see you in chapter 7.